So are we, is everyone here before I start?
We're not on line yet. It takes a minute or two.
Okay.
We're live now.
So I'm good to call the meeting to order?
Correct.
Okay, so it is 10 o'clock. I'll call the Board of Health meeting to order for Friday, March the 5th. And let's begin with the roll call, please.
Sue Patterson.
Present.
Ann Edie.
Present.
Selwyn Hicks.
Here.
Brian Milne.
Here.
Brian O'Leary.
Present.
Chris Peabody.
Present.
Helen Claire Tingley.
Present.
Al Barfoot.
Present.
Nick Saunders. And Mitch did send regrets.
Okay, so we do have quorum. Thank you. Item 2 is amendments to the agenda. Do we have any amendments today? Hearing none, I will ask next item, approval of the agenda. Can I get a mover and seconder to approve the agenda? And just
Peabody.
Thank you, Chris.
Edie.
Second. And Edie, second. All in favor, just raise your hand, please. That is carried. Item 4 is disclosure of pecuniary interest. Does anyone have a disclosure? And if one should arise during the meeting, you may declare it then. Item 5 is adoption of the minutes from Friday, January 22nd. Can I get a mover and seconder for that, please? Helen Claire moves. And seconder, please.
O'Leary.
We'll take Brian Millen for that one. Any discussion regarding those minutes? Seeing none, I'll call the question. All in favor? Just raise your hand. That's good. That's carried. Thank you. Item 6 is the provincial appointment. We received notice, order in council, new provincial appointment of Alan Barfoot. So congratulations, Al.
Thanks, Madam Chair.
Good to see it's official.
Yeah, finally.
Yes. And at this time, I'd just like to say I'd like to thank Brian Millen. I was remiss at the last, when we announced Helen Claire's appointment, for Brian stepping in when we needed to call executive meetings. He was part of it so that we could hold those meetings. So thanks, Brian, for doing that. Item 7 is presentation from the Community Safety and Wellbeing Steering Committee. So we have Andrea Riley from Public Health Manager, Barb Feedy, Director of Social Services for Grey County, and Sarah Cowley is the Coordinator for Community Safety and Wellbeing Plan. So welcome, ladies.
Thank you so much for having us. We also have Christine McDonald with us from Bruce County.
Oh, good. Thank you.
Excellent. So I'm going to share my screen so you can see the presentation. Let me know if you see it.
I do.
Oh, there we go.
Yep.
Nice and clear, everyone?
Yes. Yes.
Excellent. Thank you so much for having us. We're really pleased to be able to share this update with you regarding the community safety and wellbeing planning for the municipalities of Bruce and Grey. We've been on this roadshow since early November, and I believe this meeting today wraps it up. So we're very pleased about that. So the goal today is to share information with you about the partners who've been involved in this planning process and to update you on where we landed with regards to phase 1 of the project, to let you know about the priority areas for risk for action within our plan that has now been presented to councils, to explain the key components of our indicator report and the next steps of the work as we move forward, to look at the plan for sustainability for the work across Bruce and Grey, and to talk about phase 2, which has now been initiated. So just to highlight, many of you have heard this presentation already, but to highlight again, the community safety and well-being planning, the goal is to achieve sustainable communities where everyone is safe, has a sense of belonging and opportunities to participate, and where individuals and families can meet their needs for education, healthcare, food, housing, income, and social and cultural expression. And ensuring these aspects of lives for our community residents will ultimately lead to a reduction in crime across the region. So as many of you would be aware, this process is legislated under the Police Services Act, and the 2 counties and 16 of our 17 local municipalities came together and entered into an agreement to complete one shared plan. And this remains at this point in time the largest and most unique collaboration in Ontario. So the framework, just to give a high level overview, the framework for safety, community safety and well-being really focuses on 4 realms of intervention, 4 rings of intervention based on the diagram you see in front of you. So we're looking at incident response being the most, one of the critical pieces when an incident occurs. And then you can see the rings get bigger from there. They look at risk intervention, prevention, and social development. And so what we really want to do as we're moving through this planning process is, of course, make sure we have the right services available in each of those rings, but really in relation to crime prevention, start to shift our interventions out towards prevention and social development. And just an example of one of the rings. So risk intervention, we are looking at the situation table for acute response. That is a key part of the framework that was rolled out a number of years ago, but has now been integrated into the community safety and well-being planning framework. So our advisory committee, one of the largest groups across Grey Bruce, we have 72 partners at the table. You can see between the counties and municipalities, we have 18 partners. We have 2 First Nations partners at the table, 8 police services and all 14 police services boards. 6 organizations are represented from children and youth justice. We have all 3 school boards and Georgian College at the table. We have 9 community and social service organizations, 5 providers from health and mental health, and then we have 6 co-chairs or coordinators for the community committees and collaboratives that already exist in Grey Bruce. So the work of our plan really involved almost 2,000 residents from across Bruce and Grey who took part in our first public consultation process last spring through a community survey. The financial support of both counties and the 16 participating municipalities who use those funds to hire me to drive the work forward. Hundreds of hours of employee time from each participating municipality, the organizations and the committee that were donated, and then in-kind support as well from Grey County in the development and launch of our website. We also had support from the Grey Bruce Health Unit, Grey and Bruce Counties, CCI resources out of Orangeville, and the services of an epidemiologist in order to assist with our phase 1 survey for the community and the data analysis that followed. And then we've also been very, very connected over the last 18 months with the Canadian Municipal Network on Crime Prevention, who is driving this safety and well-being work nationally. We partnered with Halton Region to learn what they had the process they had come through as one of the pilot communities. And we're also a member of the Ontario Municipal Social Services Association working group of coordinators for the safety and well-being planning process in Ontario. So phase 1 timeline, I mean, we're past this now, but to let you know, we kicked off in September of 2019. We did asset mapping. We looked at our website development and survey creation. We had community engagement, again, significant through our survey across Bruce and Grey. Of course, we hit COVID in March and continue to feel those impacts. I know the Board of Health and the health unit more than many. We then looked at our survey analysis from April to August of last year and did a local data collection and analysis as well to inform our indicator report. We created the plan in September and October and looked at our performance measurement identification for the work moving forward. And then in November and December and into the new year, we looked at plan adoption by the municipalities, sustainability in an ongoing way, and our indicator report development. Our model, you can see a small image here, but it is on our website and also in our plan. We really are looking to our community for those champions to help us engage the community and really drive awareness. We have our multi-sector advisory committee and then a steering committee who support my work as the coordinator to make sure that we're really moving forward. I'm, as the coordinator, driving that work, including the implementation, monitoring, evaluation, and supports to the committees and action tables. And then right now we're looking at identifying those action tables to really provide the content matter expertise for our identified areas of risk and to create those specific action plans and look at monitoring and evaluation as we move forward. So what are our priority areas for action? Well, no surprise to anyone working in the community and serving the public. Priority risk area 1, and just to let you know, these came out through our data and were reinforced by the resident perceptions through our community engagement survey. So priority area 1 is addiction and substance use. And some of the key indicators for concern that we continue to need to pay attention to and look at as we drive to action is that regular heavy drinking remains a known issue in our community, with self-reported use in Bruce and Grey tracking higher than the rest of Ontario. Of emergency department visits, over half are linked to alcohol, and there has been a 2.5 to 3 times increase for opioid-related visits. Our school student alcohol and cannabis use is increasing, although this concern is not necessarily reflected right now in some of the local police data for drug offenses because of the legalization of cannabis in October of 2018. Also, we know that addiction and substance use is the cause of increasing hospitalization and death in the region. Of course, no surprise to anyone connected with the health unit to hear that. Priority risk area 2 is mental health. And what we see there is that self-rated mental health indicators show approximately 20% of our residents across the region are experiencing a lot of stress, and 15% are seeking help for mental health issues. We know that more than 30% of students in grades 7 to 12 experience moderate to severe psychological distress, and a third of those want to talk to someone about their mental health but don't know where to turn. We know that calls to both EMS and police services in the region have seen an increase related to mental health concerns, and that calls to 211 for mental health supports have also been on the rise. And we know self-harm emergency department visit rates have tripled among our young females locally, which is comparable to the province. But what isn't comparable is that Bruce and Grey males aged 25 to 44 years have higher hospitalizations and death by suicide than the rest of Ontario. Priority risk area 3 showed up as crime prevention. And although it's difficult to get a clear picture of the police crime statistics for the region as a whole at the moment, due to the different reporting systems across our 4 local OPP detachments and 4 police detachments, for police services, pardon me, our individual statistics are available and we've been diving into those. What we do know regionally is that criminal court cases do show trends are increasing over time for most offenses. Between 2017 and 2019, there was a 17 to 27% increase in most offenses. And overall, although assault injuries are comparable to Ontario rates, the Bruce and Grey rate of emergency department visits due to assault is higher than the rest of Ontario. So that's something we certainly want to look at more in a more in-depth way. Priority risk area 4, no surprise to all of us on the committee, was housing and homelessness. So compared to Ontario and Canada, our region has more owned dwellings and far fewer rental dwellings. And some areas also have more subsidized housing than the rest of Ontario. So Owen Sound, Meaford, Kincardine, and Southgate, to name the 4 key locations. We know that over 15% of our homeowners and almost 50% of our renters in Bruce and Grey spend more than 30% of their monthly income on shelter costs. And that's the generally accepted cutoff for affordability of housing. And this is a situation that leaves many people only 1 to 2 paychecks away from homelessness because they don't have the reserves to be able to pay more or to last if anything happens in their personal life. We know average housing prices are increasing, although they still are lower than the rest of Ontario. And we have a very low rental vacancy rate in our region, which means if people need to move or downsize, there's very little stock for someone to move to. We also know seasonal housing numbers are high in North Bruce Peninsula, Town of Blue, and South Bruce Peninsula, and our housing wait lists are increasing as are calls to 211 for housing issues. For priority risk area 5 then, poverty and income, median household incomes in our region are lower than the rest of Ontario, and they are the lowest in Owen Sound, Hanover, and South Bruce Peninsula. We know that approximately 20% of the children in our region continue to live in poverty based on the low income measure after tax. This is highest in Huron-Kinloss, Chatsworth, and then Owen Sound, Southgate, and Erin Elderslie. We also see that trends from various organizations are showing increasing needs for many of the community supports, such as Ontario Works, ODSP, the United Way Backpack Program and their utility assistance. And we see a sharp increase in calls for 211 related to food and meals and utilities. We also know that over a quarter of those residents who are spending more than 30% of the income on housing, 5% in the past year had not paid rent or mortgage on time, 18% report not paying other bills on time, and 9% told us they ate less because they did not have enough money for food. So what do we do with all this? These are these wicked problems. They're big, they're systemic, and they are cross-sector. Well, we want to focus on our local solutions and collective impact. So the goal of the framework and the planning together is that this collaborative planning across sectors really allows us to make sure that responses and actions are systems-based and are tied to project outcomes that can then be evaluated. So the plan is designed to leverage the good work already being done across Bruce and Grey by enhancing the collaboration and coordination of the various organizations, committees, and initiatives. And I would also add to that to help organizations plan with community safety and well-being in mind, because people are already doing good work in these areas. When looking at facilitating outcome evaluation, this is where our indicator report comes into play. And we're actually just in the final stages of revising this. The goal is to hopefully present this in early April to the advisory committee and the communities. So the Municipalities of Bruce and Grey data and indicator framework is something that we'll be talking about in there with regards to really key indicators, not just for the 5 priority areas of risk, but also with regards to 5 others. So there's actually 10 categories in the safety and wellbeing planning framework that we could look at. And so what we want to do is present some baseline data. It's a snapshot, a point in time, and it is generally all pre-COVID information to give a summary then of community resident perceptions and to identify some of those key areas for action. So it should help facilitate outcome evaluation as we move forward with local data and will be a resource for the advisory committee and action tables. So sustainability for this work, it's a big piece of work. It's a lot of parties to bring to the table, but the counties and the local municipalities are all in various stages of finalizing their budgets for this year. And there was agreement regarding the need for resources for implementation, the phase we are currently in for 2021. And so this budget involves continuing a shared funding model that was created for phase 1 of the project and will allow the leveraging of a pool of funding that would be sufficient to continue with coordination and driving of the work into action. We have learned, and of course know from other community committees over time in Grey Bruce, that without that resourcing, the momentum gained in phase 1 of the project with the presentation of our plan would be at risk. And we know that by pooling resources from the municipalities and the counties, that there'll be a reduction in the duplication of work. So having one plan will reduce the overall implementation costs for those individual local municipalities and will also allow for a streamlined approach to action. When we look at the next steps for this work, we have wrapped up phase 1. We're moving into phase 2 initiation. And so we presented to the county councils for endorsement and to municipal councils for approval by resolution. We've posted the plan. It is on our website, and then the indicator report will be posted there once it is final. These can be posted on the county and municipal websites and partner organizations as well. We'll begin looking at annual budget confirmation for sustainability of this project because it is a long-term piece of work and is meant to be a long-term planning and evaluation process. We'll be looking to recruit a new coordinator to drive this work forward as my term is up at the end of March. We will be we're currently in the phase of identifying those action tables for each of our priority areas of risk and then working with them to look at that local data in the indicator report, drive those really specific action plans, and look at further community engagement with target populations, with municipalities, and with the community at large through another round of community engagement survey. And then ongoing, we'll be looking at that monitoring, evaluation, and revision of our plan, which we know is spoken of in the legislation. And there will be annual project reports to the advisory committee, to councils, and to the ministry. Thank you for your time. That's 18 months of work and more in a nutshell. And the rest of my committee, the steering committee members, are happy to take questions as well.
Thank you, Sarah, and your committee. Well done. A tremendous amount of work, and I'm really impressed that you have 72 partners involved. Like, that's going to be a real help, and just the information that's coming out of this is going to be beneficial to every municipality in the counties. So I'll open
Thank
it up
you.
for questions or comments. Helen Claire, you're on mute.
Okay, let's try again. Thank you, Madam Chair. And through you, I also commend this. This report is amazing. I note the 72 partners, but I didn't see any reference to the Amish or Mennonite communities. And we do, of course, have those communities in Grey Bruce. And I wondered, were these groups approached at all? Did the surveys involve them? Was there any engagement or data collection or any form of consultation, in particular to the Amish and Mennonite communities?
Thank you for the question. Yes, we did when we went with the community engagement survey last spring, which thankfully did close right as COVID was shutting down our communities. So again, a pre-COVID snapshot of safety and well-being. We did reach out to the Mennonite and Amish communities in hard copy. We had surveys completed, small group of individuals. Our goal had been then to run focus groups and to connect more in person, which I know is more of the preferred way of communication. But due to the COVID restrictions, we were not able to do that, as we had planned to have, municipal engagement sessions as well in the community in each of the participating municipalities. We weren't able to do that because of the COVID restrictions. So we do know that that is a piece of work now moving forward to see how we can move forward with those priority areas of risk, talking more with particular populations and really fleshing out that detail of perception and need as well.
Other comments or questions? I don't. Okay, Anne, go ahead.
I was interested in your statistics on child poverty, and that really concerns me. And so you were saying you had statistics for each individual municipality. I would just be interested in knowing them for the municipality of Kincardine. You don't have to tell me now, but if you could just email that to me.
Absolutely. So those statistics came from Census Canada, and I know that there is new census data coming out, being released, but those reports for 2016, which is the data we used, are actually on BG Disc and can be accessed through the Grey Bruce Health Unit as well. They have the reports for each municipality, the profiles.
Thank you very much.
You're welcome. I can send you the link as well.
All right, excellent presentation, and if we can pull it all together and get more emphasis on the prevention side, that'll be wonderful.
Excellent.
Madam Chair, a comment,
Yes.
if I may.
Dr. Era, please.
Yeah. Thank you. I have a comment, not a question. I just want to thank Sarah and the committee for the great work. It's a mammoth task to actually be completed within that relatively short period of time, window of time, and during a pandemic, and that's kudos to everybody who worked on it. And if I can elaborate a bit more on the Amish and Mennonite community, we do capture their indicators related to safety from different sources, whether it's the health unit or the police, and we do work in different groups. And I know that this information, although not directly related to the project from the community, it is indirectly factored in as well.
Thank you.
Yes. All right. Well, very good. Thank you very much for presenting. And you said this is your last presentation. So that's a big job done. So thank you very much.
Thank you. Thank you, Madam Chair. Thank you, everyone.
Okay. Bye now. Okay, so moving on. I have correspondence and news releases. So let's start with the correspondence. And I should mention, welcome, Nick Saunders. I see you are present with us, so welcome. So correspondence, does anyone have any one they would like to discuss, comment on?
Madam
Yes.
Chair, Ian, if I may just comment on two of them, there is a list of 12 correspondence. Two of them are for endorsement, the rest are for receipt. The two for endorsement are quite helpful to the cause of public health. Sorry. The first one is related to the Council of Ontario Directors of Education. They put forward a support for a school nutrition program, and they included, to my delight, 4 points. One is related to language barrier, and the other one online training. And there is more advancement of nutrition science implemented in the program and sufficient funding. So these 4 points are, I believe, inclusive, and that's would be for endorsement. And the other one for endorsement is from MPP Settler, a private bill to provide permanent paid sick days for Ontario workers. And I know many of the health units, our colleagues, have endorsed this. The rest of the correspondence are for receipt recommendation.
Thank you for that, Dr. Era. Any comments or discussion? Al?
Thanks, Madam Chair. Just on the last one Dr. Era was talking about, for those of you that are more in the know on it, so is the Ontario government looking then to pick up the tab for the unpaid sick days? Or just, I can't see the small businesses being able to afford this. And I know in reading some of those excerpts that were forwarded, it's talking about the province picking it up. But I just wonder if that's part of it or if that's still a discussion point.
Thank you.
Through you, Madam Chair, I do believe it's a request to the government to pick up the tab. I did not go in the details of the bill itself. And as you know, in the second reading, it might be adjusted or changed. So I don't know specifically. I can look into it and circle back by email to the group.
Okay, thank you.
Okay.
Helen Claire?
There, sorry about that. I just wanted to comment more than anything else. Precariousness and low wage earners tend to be the ones not to have the sick days. So obviously it's a matter of equity, but it's also a matter of public health for sure, because those workers tend to be overrepresented in the food and service industries, where they're forced to work when they're ill, and therefore those illnesses become rapidly communicable. So absolutely, wholeheartedly, from my point of view, this is something to move forward with. To my honorable colleague's point with regard to who's going to fund it, I think that is the difficulty. I haven't read the proposed bill either, but I think that is at the core of some of the pushback, because small businesses are struggling. Of course they are. So it will be interesting to see. There is this groundswell to move it forward. It will be interesting to see how it all plays out. Thank you.
Thank you. Any other comments? Okay, could I get a mover and seconder?
I had a comment. So didn't
Yes.
MPP Sattler's bill get voted down this week? I wasn't sure where we're at with that. I know there's a number of bills on paid sick days, but I thought there was a vote.
I'm not aware of it.
I don't know. Did anybody else hear about that? Maybe I'm wrong.
Madam Chair, through you, I will look into the details of the bill and whether it was voted on or not, and circle back by email to the group.
I believe we can still endorse it though, right? We should. So a mover and seconder to endorse those two items. So I have
Barfoot?
Pardon me?
I can do my first motion now.
Yes, you can.
I
Okay.
would move it, Madam Chair.
All right. So we have Al Barfoot and Brian O'Leary to second. All in favor? That's carried. Thank you. So we'll move on to the media, and then
Excuse me, Sue. I was just wondering, when you said two motions, Was that for both, or was that just two aspects of the one? I missed that.
That was one motion to endorse those two items in the correspondence.
The nutrition one as well.
Wait a minute, number one. The one with, yeah, number one and number three.
Okay, I just wasn't clear on that. Thanks.
Yeah, so one motion to endorse those two items on the correspondence. So we have remaining correspondence to receive, but if we look at the media package, we could review it and then have a motion to receive the remaining correspondence and the media items. So are there questions about the media package with those numerous news releases? A lot of work going on there. So, all right, I don't see any, so I need a mover and seconder to receive the remaining correspondence and media package. So I have Helen Claire to move that.
Sorry, through you, Madam Chair. I did go through all the correspondence. I may be asking about this in the wrong spot, but there was Alpha correspondence asking for nominations for an award. Is this part of the correspondence that we're looking at right now?
I believe that's a specific item at the towards the end of the agenda.
Thank you very much.
Yes. Okay. So now we need that mover and seconder, Helen Claire, and Nick Saunders, can he move? Can you move? Are you allowed to move?
Madam Chair, Nick is still a guest, and that process for an application or alternative is still pending.
Sorry, Nick.
So he cannot vote.
All right, but did you have a comment, Nick, maybe? No? All right. When it's official, you'll be able to move in second like Al. So, all right, so we have Helen Claire, and my seconder is Deputy Mayor Hicks. Sorry, Selwyn Hicks. We'll forget the deputies and councillor part. So all in favor? That's carried. All right, so moving on. Now we have item 9, which is the Medical Officer of Health, the updates. So Dr. Era, the floor is yours.
Thank you, Madam Chair. My update is verbal this time, and it has 3 sub-items, or 3 items with some sub-items. The first one is situational report from Grey Bruce. We remain in full control of the pandemic locally. The number of new cases has been 0 to 4 for the past few weeks. Outbreaks almost non-existent. There is only 1 outbreak in a long-term care, and that's 1 case with no secondary transmission at this point. The school sector, no outbreak. Long-term care, retirement homes, childcare, workplaces, all of them outbreak-free, which is a success to everybody around the table and the collective effort in Grey and Bruce, all partners. The second item for update is non-essential travel related to Grey Bruce being in the green, according to the provincial framework versus our neighboring health units, some of them with higher risk, including the Grey. And this is a source of concern. We were in a similar situation early December before the lockdown, and we had prepared communication and other tools to be utilized. The lockdown was very helpful in eliminating that source of concern. Now we're back into that situation, and especially with the increased accent between the level of risk from Simcoe Muskoka versus Grey. And we do believe we have the ability to manage it with communication without the need to orders. And that's the principle of least intrusive, a principle we use in public health on a daily basis when we make decisions. And so far, looking back in time over the past year, that principle. With education only, we have been successful in preventing transmission. There was not a single reported case from visitor to a resident or from a visitor to a visitor throughout the summer, despite the fact that thousands came to visit our beaches and area. So going forward, we are monitoring the situation. We sent communication asking the residents to be more vigilant, especially in communities around the border of Grey Bruce. And we asked the businesses to follow strong recommendation. It's recommendation, it's not regulation or order. And the recommendation would be directed to two sectors, the hockey activities and personal service settings like hairdressers and other services. We believe that's where the level of risk and the fact that the hockey is recreational activity. Those two sectors, we ask people who work there to be more vigilant, and people who operate these activities to consider as they see fit, whether they wanted to turn away customers. So for example, concrete example, hairdressers know their customers and know if they are local, and many of them through communication with our health unit would appreciate that direction, because it empowers them to turn away a customer if the need be. And if the viability of the business is necessitates that they take customers, again, that's a decision that they can do. And we realize that 12 months of pandemic can affect the viability of a business. So we wanted to be we want to give them all the freedom they need to manage that balancing between safety of the community, the clients and themselves and their staff, versus the viability of their business. And I believe we are striking a good balance at this point. One final point on this item, Madam Chair. We monitor the situation through the number of complaints from these businesses to let us know that there are more people coming over, and we definitely will act and increase the level of recommendations, or if necessary, an order to address it. And again, even if there is an order, we can be surgical in our approach, so it doesn't have to be an order to everybody. And I want to remind our audience or people who are listening to the board meeting that staying calm, staying positive, remembering it's a hardship for everybody. It's not us versus the visitor. We're all in this together, and that will carry us forward. And we need to see through the emergency, because our economy depends on tourism. And I mentioned this before. One example, in Toronto, the tourism industry didn't recover for 8 complete years after SARS. And in Grey Bruce, I believe we maintained that balance where our tourism or visitors have been coming and the activities that have been taking in our area have been safe. So that's an update on that item. The final item is related to vaccine rollout. This week we have 35 clinics, modest in size. They're not operation of the hubs yet. And it's related to the limited supply. It is anticipated that this supply will be increased late March, early April, or as early as mid-March. Nevertheless, at some point in the imminent future, we'll have increased supply provincially, and locally by proxy. The pilot for the software for booking is something that we all will benefit from, and our residents provincially. The province piloted a software for booking that allows for registration at the same time. So that's really saves quite some time during the process of vaccination. So people can register themselves earlier, they can book themselves. And the health unit has been one of the few sites, the 5 sites that have been piloting this. Sorry, 6 sites. We are the number 6. The other update is the hub. As you know, we have had a walkthrough related to hub, and we are planning for opening of the hubs formally with invitation from VIPs, hopefully mid-March. And we do believe the hub model and system will be a game changer in delivery of vaccines at the population level. We have had a few health units, cities, and jurisdiction reaching out for support, and it's worth mentioning that the Chamber of Commerce for Ontario has struck a council of, they started by 50 businesses. Right now, it's over 250 businesses, including Facebook Canada and Bruce Power chairing that council to support the rollout of vaccine, including providing equipment, donating equipment for hubs. And we have been leading that initiative to bridge the gap between the private sector and public health, to utilize anything we can utilize to address this pandemic. And that will be something I hope will continue after the pandemic, and I can see many benefits for the public in bridging that gap. So, Madam Chair, that's my update on the vaccine rollout and COVID. Open to questions as always.
Thank you, Dr. Era. We'll start with Brian Millen, Brian O'Leary, Chris Peabody, and then Al Barfoot, and then Helen Claire.
Thank you, Madam Chair. Two things, Dr. Era. First is your 2 emails last night regarding the pilot program. The fact that the pilot was successful is good news, but my concern is around your second email saying, please keep the below in confidence at this point in case the province may want to announce this. Quite frankly, I'm getting tired of this whole notion that we can't do anything until we put a minister in front of a camera somewhere. Why are we waiting? Like, let's get on with this. If the pilot's working, if the online thing is working, let's get on with it. My second question revolves around a question that I've heard around patients, particularly on the border regions of the health unit area, Grey Bruce, people that have a doctor outside, say Shelburne, Collingwood, Mount Forest, and are those doctors, and I guess you could reverse it the other way around, but are those doctors going to be calling patients inside Grey Bruce and asking them to come to clinics outside of Grey Bruce? Or are those patients strictly going to have to deal with the 800 number to book a vaccination inside Grey County?
Through you, Madam Chair, addressing the second question probably is straightforward. Having the 800 number to capture people who don't have family physician, or their family physician is not inside Grey Bruce is the most practical way, and we have planned for different scenarios for this, and that will be March 15th. To start with, even if we open a line right now, it's not going to change the fact, because the limited supply of vaccine is the main barrier there. So it's not capturing them, rather other parts of the process, which is limited vaccine. The first one is the pilot is still ongoing. The initial results are positive, and those processes from our side, we can say all of them are excellent. Nevertheless, the process takes more than just one pilot or one part of the pilot or the system. So I trust our provincial colleagues will utilize it as soon as it is available. And the fact that the pilot can be completed in a matter of days and weeks is quite the achievement. These things in non-COVID times might have taken months. So again, I realize that there is a requirement and people are eager to book an appointment. I would urge our audience and urge decision makers to remain calm with this, because it is the best way forward. We have the plans, we have everything ready. As soon as we have a vaccine, we will provide it to anybody who needs it.
Thank you, sir.
Okay, Brian O'Leary.
Thank you, Madam Chair, and through you, Dr. R. I'm just wondering about these people that were concerned about traveling to the green area. Maybe you can't answer this, but do you know, is there adequate communication at the other end for these people, like municipalities that are maybe in a red zone? Is there adequate communication letting those people know that there is travel restrictions, or is there mandates at the other end, or do we have that information?
Through you, Madam Chair, I am confident there is communication. I'm not, I can't claim that I know exactly the level of engagement or information that the public receives in other health units. It's just a different jurisdiction, so I don't have access to that. I have collaboration with our colleagues and wages in other area, and I know they're doing their best through communication with local businesses and individuals. It seems that the number of people coming at this point is quite acceptable or reasonable. Councillor, if I can just go in to answer the question sideways. Usually, if there is that much discrepancy between the level of risk between two areas, it takes time. Time is a factor for people to start being uncomfortable with the lockdown. For example, it might take a week or two for somebody to exhaust their food supply in their home and seek getting grocery from somewhere else, or to need a haircut or need to go to a restaurant. So it's not going to be immediate. We will expect in 2 weeks to see more concern about this issue, and we will communicate with the neighboring health units. We communicate with the ministry to see if there is any potential solution from both sides. Nevertheless, I do believe our best investment, and it has delivered, is to communicate with our local residents and businesses, and they have been doing an awesome job over and beyond what's required. So back to your question about communication in other area, I'm not the expert in understanding what's going on because I don't have access, and I do believe what we have locally can address that concern regardless of what other people are receiving for communication.
Okay, and the second one, I'm not sure it's the health unit, or it's, I'm not sure if I should be asking you this. I'm just wondering, these hubs, will there be reimbursements for loss of revenue with these arenas that are being used in the rooms, or is that like a question for like a Gary Simmons?
At this point, we are not looking at reimbursement, or I don't think that's considered in the process. We can explore that if possible. I know that the health unit can receive funding to support certain clinics if we need to open them through partners. I do see the value in utilizing the optimal collaboration we have in Grey Bruce. Reimbursement definitely will be useful. Nevertheless, that might really take away the essence of the collaboration, and that's what carried us this far in the process.
Okay, thank you.
Chris?
Dr. I'd like to congratulate you and your staff on all the great work you've done. I really appreciate the messaging that you did on the 80+ group. I know I talked to you about that on Wednesday, and communication that came out afterwards, and then to get those 80+. The first ones vaccinated yesterday. That was fantastic news. So we're definitely ahead of some of the other rural health units on that 80+ group, which is very important. So thank you very much to your staff for getting that up and running. And also like to offer congratulations to your staff. Just looking at the data this morning, and the Grey Bruce Health Unit is the lowest for cases per 100,000 in Ontario, as well as the active cases. So this region is just doing fantastic. So it's a credit to you and your leadership.
Through you, Madam Chair, thank you for your remarks, Mayor. Yeah, I wanted to mention this at the end of my update, but probably this is an appropriate place for it. I want to thank the managers, the staff, for the effort they have been doing. Our managers have been burning the candle at both ends. The long list or thick list of media releases here is under the leadership of Drew and Ian Reich. Both of them are managing the communication team, and the communication team have done that great job. I do believe no matter what I say here, it's not going to even put a small dent or justice in the thanks that are required to them. Thank you.
Okay. Al?
Thanks, Madam Chair. I guess I wonder if Dr. Eric could maybe comment on what I'm just going to say. I think he's got an excellent rollout procedure, because all the 34 health units have different ways of rolling out the vaccine. When I read an article either this morning or last night from the Premier, where he is saying that he's going to have Shoppers Drug Mart pharmacies doing vaccinations, I haven't seen that anywhere in Dr. Ayer's outlook on it. So I just am concerned that is he all of a sudden, implementing something else into each unit that wasn't there previously?
Thank you, Madam Chair. We actually factored in the pharmacist in the plan in the traditional distribution system for vaccine. We have two systems. The traditional one is through family health teams and pharmacists, and the other one is through the hub and community mobile units. And through this first system, we have the pharmacist traps on the task force, and they have been communicating with all pharmacists in Grey Bruce. And we actually provided something unique that I'm not aware it exists anywhere else in the province. We mapped out volunteer locations, organizations in Grey Bruce that would provide space for mass immunization in all 17 municipalities. And we mapped out through the pharmacist traps any pharmacist who's willing to go outside of their pharmacy to vaccinate. As you can appreciate, there's a waiting time after the vaccine of 15 minutes, and pharmacies don't have space for wait or recovery areas. So if they're going to vaccinate in a pharmacy, it's going to be 1 or 2 patients per 15 minutes. So we married these two lists, the list of volunteer spaces and volunteer or willing pharmacists. And we actually married a third list, which is a list of volunteers who can support these pharmacists. And that last part is not complete yet. However, whenever that rollout of the vaccine to pharmacists starts, we will be ready by that time. The general directed that about 2 weeks ago, and we've been ready for it at that time to communicate with pharmacists. We have been communicating with them way longer than the 2 weeks. And if I can finish with one point there, that there is a pilot of 3 areas, 3 health units in Ontario that are supporting pharmacies or working with the pharmacies rollout at this point. We're not one of them. However, we are ready when the vaccine arrives.
Okay. Helen Claire, is that good, Al? Yeah, okay. Helen Claire?
Thank you, through you, Madam Chair. Seeking some clarity around the interprovincial travel issue, people coming in to get their haircuts and so on. Just wondering, is there written direction from the health unit that is provided for these individual businesses, these hairdressers and salons, to offer support to them so that the onus isn't on them, doesn't land on them for individual, the responsibility of policing people that might come in and show up at the door of a hairstylist and want to get their haircut. I'm just envisioning that there might be some potential problems for a business owner, a hairstylist, to then have to deal at the door and say, no, I'm sorry, you're not from here. We don't want you, kind of. Whereas perhaps if there was something that they could post in the window, because It isn't the law. It's against the charter, of course, to restrict movement from anybody. It is a suggestion, and it's for good reason, and so on. And I'm just concerned that, again, an individual business owner might be put on the spot, particularly a hairdresser, to have to potentially deal with something that they're not trained for, that perhaps we can obviate by just having something that is posted in the window that they can just gesture to and use that. Just looking for some clarity and discussion around that. Thank you, Madam Chair.
Through you, Madam Chair, there has been communication with the businesses, and definitely having a poster would be one of the appropriate next steps if need be. That will be upping the intrusiveness from just recommendation. The intra-provincial travel or inter-provincial travel is recommendation from the province and from us. And as you mentioned, there could be charter issues. Nevertheless, turning away customer from business is within their right. Every business is entitled to have policy to turn away and not service people, my understanding from our legal and from dealing with businesses. So we would leave this decision in their hand at this point. If we send a communication to be posted, we're actually upping the recommendation that might create more issues if certain businesses don't want to turn customers away versus others. So at this point, we're trying the communication, and we send it in writing as a media release, and I believe at different communications with businesses as well. I will double check if the memo went to the businesses similar to the media release or not yet. Nevertheless, posting is an appropriate next step, and everything is on the table if the need be.
That's good. Helen Claire?
Yeah, I'm just concerned, again, not to beat it to death, but if we're asking the businesses to do this, I think if they have the option of that piece of paper, then they can hide behind it. It's not something where they are then going to have to take on an individual. Certainly most people, I think, are good, but if we're looking at getting an influx into this community, I just would hate that we then go to that step after an incident. One incident, if we can anticipate it and avoid it, is one incident too many, you know. And there are some people who are anti-maskers or who don't think it's fair, or so on and so forth. I would not want to see our friendly neighborhood hairstylist trying to explain a public health initiative that we're trying to do in this community without backup, that they might then be able to just say, you know what, this is what is said. That if they have that piece of paper, they can choose to post or not post, as they can choose to enforce or rather to suggest that they're not going to see that person or not. But it just means that they're not there alone. So that's all. But obviously, I defer to Dr. Ara's expertise in these matters. Just wanted to flag this concern that I feel. Thank you.
Okay.
Through you, Madam Chair, we did send the media release to the public. So that is our recommendation to support these businesses, to empower them. We communicated with them on different occasions about this. So it's not out of proportion. I will double check if a specific memo went out to all these, and that was my direction actually, to have it in writing to them. Nevertheless, the media release would cover that completely. It is our formal position to take the heat if there is heat. And again, we really never directed businesses to do their own enforcement. They're not trained in enforcement, and that was a subject that I believe was completely ironed out during the summer, July and August, when the recommendation or the order for mask use was there. So businesses know that they don't have to escalate it. They can turn away business customers. I can think of the example of bars. They can always turn away customers. And if there is a requirement for escalation, it will be enforcement agencies. And again, I really appreciate the thought that it is definitely our approach to empower the businesses and allow them to say the public health recommended this.
Okay, Selwyn.
Thank you, Madam Chair. I could follow up a little bit on the question of communication raised by Councillor O'Leary and HC. I can tell you that last week there was quite a bit of interest from the media on this subject, and I was called upon to have a number of interviews with CTV News, London, Kitchener-Waterloo, Windsor, with CBC Radio as well. Quite a bit of interest because, of course, at that time, Simcoe was moving to lockdown, and we were, the next door neighbor. And similarly, in London and regions like that, they were in a different circumstance. So quite a bit of thought went into the messaging, and it was quite extensive. The messaging of that up till this point, we've been able to enjoy quite low numbers. And we know for a fact that people are visiting, and that for the most part, people have been very respectful. We've had certain places, like at the falls, in certain places where we've had incidents with parking. Certain sections of the Bruce Trail have experienced issues as well. But those are isolated incidents, and for the most part, people have been cooperative and respectful, and we were urging people to do so. At the same time, the messaging has been that we acknowledge that there are a number of people who have second homes in our area and who have cottages in our area. And they may choose to come, but we were asking that, first of all, they recognize that it's not recommended, that the recommendation is still on all unnecessary travel be abated. And secondly, that if you are going to travel, that you, again, be respectful, try not to stop along the way. If you're going to be coming, make sure that you maybe bring your groceries with you. And once you're there, that you observe the rules of that of the local health unit. And basic decency to recognize that, we are not in regular times, that for the most part, while we're not encouraging people to come to our area, which is unusual for us because we heavily depend on tourism, we are also not really chasing people away if they are here. We're recognizing that some people may want to be here because they have that second home or the cottage, but to recognize that it's not business as usual. For example, we have the ski hills open at the Blue Mountains, but again, very limited passes, mostly for season pass holders. And if you think you're going to show up and just buy a pass on the day up, you'll be sorry, because it's just not going to be available to you. So we were sort of putting out that messaging. It was heavily picked up. I tell you, so many people have called me, friends from all over the place, and said, geez, we saw your message in Windsor or in London. So there has been that interest, and it's been fairly widely reached, in addition to everything else that Dr. Era has mentioned that the public health unit has been doing.
Thank you. Anyone else? Al?
Thanks, Madam Chair. Just to follow up, the P&H Center looks very professionally done, and I was proud to be part of the board that is showcasing that forward through Doctor's guidance. Just wondering if the Bayshore and the arena, the Davidson Center, will look exactly the same. Will they have those same type of cubicles that will be in those for the mass vaccinations for the hockey hub? Thank
you, Dr. Era.
The other two centers, the arena was not utilized for Kincardine. The Davidson Center, it is the gymnasium, and it hosts 3 units out of the 5 units that can be fit in an arena. The Bayshore has 2 units, and it's in the community center. So they have the same principle of flow of patients and clinical delivery of the vaccine or the model itself, but it is a different space. And that's one of the features of this design. It's scalable and can be fit in different settings.
Okay, so just to clarify, so is the portable hospital then still set up in at the Bayshore, and will it stay there then on the arena floor part?
Correct, and that's the reason why we didn't use the field hospital in Bayshore. And the level of care in that hospital is similar to a regular hospital. So having it as our insurance policy in case
Sure.
the management of the outbreak didn't go as well as it has been going.
Okay, thanks for clarifying that.
Okay, Dr. Era, I have a question, a very basic. An individual, 80 plus, lives in Hanover, has a doctor in Wyerton, wants to know, will he be able to choose where he can have his vaccine?
If his name and information are collected through the list that have been collected over the past few weeks, his location will be decided by the family physician that giving the vaccine. But going forward after March 15th, if they book their appointment, they have all the choices to choose from wherever clinics exist.
Okay, because his concern is weather, right? If we get a snowstorm or whatever, and if he has to drive to Wyerton or Owen Sound, he would prefer, of course, he lives in Hanover, would like to have his vaccine here in Hanover. So of course, 80 plus people are anxious about some of those questions.
Right. And Madam Chair, that's why we mapped out locations across Grey Bruce to ensure the service will be provided as much as close to the person's residence.
Okay, good. Thank you. Any further questions regarding the vaccine rollout?
Madam Chair, if I might circle back to Helen Claire's point about essential travel, it is my direction to our staff to send a memo to these locations, and the media release, as you know, went out yesterday or the day before. So I just asked the staff to circle back, hopefully within the meeting. I can provide update whether that memo was sent or not. I just can't be involved in every single interaction with or communication that goes out to operators, but I want to reassure Helen Claire that that is actually my direction to provide it in writing alongside with the release.
Thank you. Dr. Era, there was Nick Saunders has put a question on the or a comment on the chat. If you could read it and whether we should discuss that now or it's something you would like to discuss with Nick. It's about Six Nations calling for help.
They currently have 376 active cases in the First Nations as of today. 4 deaths in that community. It's a huge media relation.
If I can ask Nick for further clarification, that's not in our area, obviously.
Just as an FYI for everyone.
Oh, his point is for information. I'll connect with him after the fact.
That's good. Thank you. Any further on the vaccine rollout or we'll move on to modernization update? Okay, we're good to move on, Dr. Era. And you are on mute.
Guilty as charged. Sorry for that. The item remains dormant. There has not been any communication from the ministry about the modernization of public health consultation.
Thank you. And the opioid situation in Grey Bruce?
Okay. Madam Chair, just an update on what has been achieved in February related to opioid efforts. Naloxone distribution, we distribute over 130 through the health unit, 235 kits through Grey Bruce. We trained 49 people on using naloxone. Safer injection kits, we distributed over 1,300. Safer smoking kits, again, around the same number, 1,300. And sharps containers, again, we continue to support that activity. All the core functions of the mandate of public health are being achieved as indicators during that month. We secured $17,000 funding for development, and it's going to be utilized in supporting the community supporting the opioid overdose crisis. The team remains working with other partners, the opioid working group and subcommittees. Some of the achievement or the activities last month is review and revision of the opioid response plan. And that's a collective work from the opioid working group, not just the health unit, but we have been participating in it. Readiness and feasibility for safe supply, and that's a sub-working group in that committee. And enhancing current outreach partnership and development for different locations in Grey Bruce. So that's just a quick summary of the activities we've been providing as a health unit for the opioid situation in Grey Bruce.
Thank you. Questions or comments regarding the opioid situation? I take it, Dr. Era, the people that were trained would be police and fire, maybe?
It could be, but it could be people from the community as well.
Oh, okay. That's good to know. So, okay, I don't see any questions. So I need a motion to receive the MOH's updates as presented. Brian O'Leary and Ann Eady, all in favor? That's carried. Thank you. So Dr. Era, are we too early to move into in-camera, or is it all right?
We could, Madam Chair, or we could go to the corporate services update if you wish.
Let's do the corporate services. So we're at item 11, the financial report for December 2020.
Okay, Madam Chair, the corporate director is just arriving. Perfect timing. He was in, he just stepped out to bring something come back.
Thank you, Madam Chair. So there's our financial report for essentially for the year is attached. It talks about some additional financing, funding that is coming through. But it talks also about we have the shortfall that we were expecting. And we've also been able to apply to the ministry for the additional funding for the COVID-19 response during 2020. Over and above that, I think we still continue to expand the number of hours that you can see on the COVID versus regular hours report. And then the last piece to this, there is the procurement part. There's one error on this piece where it talks about hand sanitization wipes. That actually needs to be striked out because that was aspirational when this was written. That was not provided. So with the other two were.
Thank you. Questions? Brian Millen.
Thank you, Madam Chair. Matt, are we confident, I suppose, as we can be, or are you confident as you can be, that the ministry is in fact going to cover all of the overtime expenses related to COVID-19?
I'm going to say absolutely yes, but I am curious to the nature of the question.
Well, I guess I'm looking, or was looking at the email that came out regarding the sunshine list. There's some significant cost there, I think, that's over and above what normally would be there. Boy, I wonder, does the ministry know what's coming at them in terms of an ask?
I believe so. They have asked us to report our expected overage, and from discussions with other boards of health on the finance side, what we're experiencing is not as significant as others have experienced.
Really? Wow. Okay. That's good. Thank you.
You're welcome.
I admire your faith in the provincial government and the treasury in particular. So good on you. Thank you.
If I may, Madam Chair, so the province would cover anything that's above our budget. And if you look at our budget for the past year, many of the activities have been altered. Inspection of restaurants was paused during the lockdown, and all the travel expenses have been reduced. So at the end of the year, the extra above our budget is way less than other health units from my communication with a couple of colleagues, like Matt mentioned, regardless whether the expense was in one program or other. The ministry said you can channel funding from one program to the other. So there is balancing factors in that number.
Okay. All right, I don't see any other further questions or comments. So we need a motion to receive the financial report for December 2020. I have Al Barfoot and Edie, all in favor? That is carried, thank you. Next on the list is the risk management update.
Madam Chair, if I may, before we dive into that, at the end, there was the procurement report.
Can you turn the camera to?
Oh, there we go.
Yes.
So there was a request to approve through the board. There was a verbal approval provided for both the signage for the P&H Center and then the Bayshore Community Center for 25,600 plus HST. I'm just looking for, the other two items are the items I was speaking about that need to be struck. They were aspirational. So the first one is the one that we're looking for because it breaches our $25,000 limit. We're looking for board approval formally.
Sorry, and what is it for again?
Yeah, so there were two purchases for signage. One was for the P&H Center to put up for the hub, was approximately $9,800, and it was single sourced and without quotation. We went to a known current supplier that's not connected to us, but clearly a relationship exists. And then the Bayshore Community Center and the Davidson Center in Kincardine required similar signage, and that was not known until approximately a week later. You can imagine these hubs are being constructed and erected fairly quickly, not leaving any time to do the normal estimation and quotation process. The job was simply let to an existing printing company that we have long-term relationships with. And together, those two purchases put us over that $25,000 by about $600.
Okay.
So if I may, Madam Chair, that's the same item that I discussed with you, and it was approved by the chair, and for knowledge for the board in the interest of time there.
Yes. Yeah, I just wanted just a wider explanation there. So one motion will cover both? Or
yes.
Okay. We have a question from Brian O'Leary.
Thank you, Madam Chair. Matt, did we change that limit at all? Has it always been 25,000?
It has not. That limit has migrated up and down, been split into various forms and functions. That is actually addressed in I think not the next item, but the following item on the procurement policy. But our overall limits have drifted significantly downward over the past 5 years.
Yeah, I don't know what everyone else thinks. I just think that number is low. Like it's before you have to come to the board, I think it should be higher, but that's just my opinion.
Yeah, we will discuss that. So let's do that motion and cover that off for the signage. So
Madam Chair, if I may just a comment there before the motion. My understanding, Bruce Power covered some of the costs for postage, actually more than what we're covering. So there is this piece of information there that wouldn't change the fact. And just a comment from related to changing the policy, it was direction from the board 3 meetings ago to re-explore that policy and bring it back, and that's why it's the next item to consider changing it.
Right. Okay, so a mover and seconder to approve the purchase for the signs. So I have Ann and Chris Peabody. All in favor? That's carried. Thank you. So the next item, you want to do the purchasing policy, or are we on that risk management update?
I think it's a risk management update, Madam Chair.
Okay, all right, good.
We've presented essentially the same risks that we had roughly a year and a little bit ago. And this is as an update to those risks. There's nothing new on this register that meets the threshold, and explanation as to what our mitigations are have slightly changed, improved in some cases, and some of it has been delayed based on our COVID-19 response to the pandemic. So open to questions. It's a report actually to the board versus requesting any approval.
The one sentence in there that says counties to provide the shortfall in 2022 sort of caught me.
Well, that is as it currently stands. The way the provincial government has set forth its funding formula is, at that point in time, there is no risk mitigation. It all does, whatever that difference is, does fall to the county. That is that shift from 75-25%, 75 being from the provincial government, 25 being from the counties, going to a 70-30 split. So that represents roughly 5% of the budget. Now, there were other plans currently in place from ourselves, but COVID-19 pandemic response both sideswiped our plans, but clearly the government, as we needed to respond, and clearly we've all been working together to do just that, including the risk mitigation funding, or sorry, not the risk mitigation, but the mitigation funding to the proposed legal change to the funding formula, both for 2020 and for 2021. The provincial government has said that that differential is not the responsibility of the counties. They're fully funding it. So they're essentially still holding on to the 5%.
Right.
Changing the timeline.
Yes. Other comments or questions on any of the items? All right, I don't see any. We don't need a motion for this. We're just receiving it. Or do we need a motion? I'll ask.
Just receiving, Madam Chair.
Okay, good. All right, so then now we're on the purchasing policy for procurement.
Thank you, Madam Chair. So I apologize for the draft sitting on the memorandum. The memorandum is not a draft, but all of the rest of the document is that the administration policy change. That's a recommendation, so it's draft until approved by the board. The memo, however, is not a draft. It is a formal memo to you, but essentially outlines that to revise this entire policy is going to require significant effort that where we are right now in the pandemic response is not available to us. But thinking about administratively, some of the, I'll say, obvious pieces to deal with is just leave the structure of the policy, change the limits, allow us to down the road when we have the time, we can actually look at changing the structure of the policy. The second part that we are actually asking for is also an exemption. So what you just saw us do for breaching the limits when it came to single sourcing, not following, gaining additional prices for quotations and estimates coming to the board. So two things are in play. One of them is the amount of limit. The second one is some of the items that actually we need to buy. When I think about some of the PPE, There's been some IT equipment that clearly falls into that response. There's medical supplies. All of these things, as we need to respond to the pandemic response, they are in short supply, and we are in competitive with other purchasing jurisdictions. And if we're to follow the rules as set out in the purchasing policy, we'll just continue to miss out on the opportunity to actually purchase some of these. We've had the unfortunate spot of we've lost a couple of opportunities to buy because we couldn't react fast enough. Thankfully, we didn't run short or out. However, those situations continue to, I believe, and will continue to persist, particularly as this vaccine rollout carries on. So there's a specific set of exemptions that we're looking for, and it is for your consideration. It's not a blanket whenever, however. I think it's set out to be very much like a banking document where you need to have at least two people internally to say yes to the exemption, and keep it fairly narrow. That's on the last page of the memo. So we present that for your consideration. Obviously, questions ready to take.
Thank you. Al?
Thanks, Madam Chair. If I read it right, Matt, then what you're asking for is to have this authorized until either the end of this year or when the pandemic is over?
Our response to it, sorry, I didn't mean to speak.
No, I'm just looking for the clarification on that. You're right. I think the whole scope of it needs to be looked at, but it's a big undertaking, and certainly time frame isn't available right now. So I'm certainly comfortable with the time frame on it for now, and then looking at the big scope later on.
And just to answer that first question about when the pandemic is over, it's our response to the pandemic. So the pandemic maybe actually said it's over as of, and I'm not going to be theoretical for a moment, but in June, but our response to it may not actually end until September, and we may still need to do those things, but when we're done, we're done. And was also given a hard timeline into it as well, so that it's not a forever thing.
Okay. Anne?
I think it's a great plan for right now. And you've put the closing date in and parameters. So I totally support it.
Brian Millen?
Thank you, Madam Chair. I fully understand why the exemption may be sought or has been sought. To be honest, though, it makes me a little bit nervous. There's no governance piece whatsoever in there. I'd be a lot more comfortable if there was some consultation with the executive committee or even the chair. Phone calls not hard to make. And I'm not suggesting that things would go south, but as some of us may have heard in the past, when things go south, it just doesn't play well on the front page of the Sun-Times. So if there's no governance oversight whatsoever on an emergency purchase, that gets ugly in a hurry. So I'm just wondering if there's some opportunity to put some kind of governance oversight, whether it's the executive committee or at least the chair, onto this list of 2 or 3. Is that too onerous?
This is Dr. Era. No, at all. And that's actually my preference. I would not want to use that purchasing exemption without full consultation. We can put it in the policy. We can continue with the current policy. I had no issue operating with the current policy. It was my understanding that the board 3 months ago said this is too low of a number, and there was some history before I arrived here why that was used. So I'm quite all right continuing with the current policy without any changes, and it is not optimal, but it has not been problematic. We did not drop any ball on purchases.
Certainly, to be clear, I'm not opposed to changing the numbers. It's the notion of not seeking the various quotes and so on and so forth, the exemption from the policy itself. That's the piece that I'm a little concerned about. The numbers themselves, change them, absolutely.
Okay, through you, Madam Chair, I totally agree, and I would write it that way. I apologize. I don't, I didn't review every clause in that change of policy, but I'm completely supportive, and that's my preference.
Okay, I have Helen, Claire, Anne, and then Brian O'Leary.
Thank you, through you, Madam Chair. It seems to me that we're in a pandemic, and I think we all would like to do whatever we can to reduce the administrative burden that's getting in the way of any efficiencies. However, it is one of our main jobs as the board to ensure that that there's fiscal oversight. So I do have some concerns too. Looking at policy number 3, for example. It removes documentation on which vendor was selected and why that vendor was selected. I'm wondering, is that really onerous to have that in there, just the 1 or 2 lines? If such a decision has to be made, and if it's at a threshold that we agree can be upped, so we agree in increasing the threshold before it has to come to the board in certain categories. I still think, even for future audit, if we've got that 1 sentence or 1 paragraph in here that this company was chosen because, then that paper piece that trail is there. And in addition, number 4 jumped out to me. The requirement for the written quote, the words written was removed. And I'm wondering again, is that onerous? Is it difficult to get a written quote in this day and age of emails? Is that really something that would slow down the process? I think having something in writing, especially when we're sole sourcing, is an important thing. And again, looking down the road at potential audits allows us to rely on this decision was made here because of this, and it's in the moment instead of us having to look forensically and figure out what happened. So those are a couple of things that I raise for the board's consideration. Thank you.
Thank you. Matt?
So on the first point, you were talking about number 3. If I can just ask a little bit of clarification. I'm not quite understanding what you're making reference to when you say about the removal of a particular written confirmation. I'm sorry, I'm going back through your conversation.
Thank you. I wasn't very clear, and I'm just flipping over to number 3 here. And in fact, I've misspoken. What it is in number 3 that concerned me was it must still be ensured that the acquisition of goods and services has been done in the best interest of the health unit. I respectfully suggest that language is vague. That if we're making such a change, the whole point of fiscal prudence is to demonstrate how. So how is this in the best interest in terms of number 3? It's pretty clear in others when you're looking at that there's going to be a written quote and documentation as to why the vendor was selected and why this is a good idea. And I'm just trying to suggest that language of always having written information about why the vendor was selected is a good idea right across the board. And in number 3, that's not there. It leaves a language that's vague. And I think we need to move to make sure we don't have, how will we ensure that it's in the best interest of the health unit? So let's just write it out. Why was this vendor chosen? So that's what I'm asking. Is it onerous to request that if we up the limits that we continue to request something in writing, which should be easy through email, and that we demonstrate in a sentence or two as to why that vendor was sole sourced. The example that was given earlier was there was an existing relationship and it made sense to go with that person. It's very easy, or it appears easy. I'm sorry, I don't mean to suggest that I know what's easy and not in your job. If it's not onerous, I suggest respectfully that we keep that piece in of writing down the rationale, not just in the moment so we can continue with fiscal prudence, but also in the case of an audit down the road. It's much easier if we've got that piece written in the moment. Does that help?
It does, and I appreciate the clarity. Thank you. From an overall perspective, I have absolutely no disagreements with what you've just enunciated. I just want to point out that the only changes that were made to this draft from the previous what's in force were the numbers. So if there's, and so I appreciate you're wanting to improve upon this particular policy. But the only changes that were made were those, what was highlighted in yellow, and what was highlighted in yellow were numbers. So if you want to make a further change, I'm okay with us proceeding down that road, but I just want to make sure that that part's understood. For me, this is an existing policy that I walked into versus created.
Okay.
So I think there was also another, forgive my memory lapse, but I also know that you made mention of a second factor that you wanted to bring forward. Can you just please review that with me again?
Sure. Can you hear me?
Yes.
Oh, excellent.
Yes.
First, through you, Madam Chair, I apologize for raising forward suggestions for a change in policy. I am new to the board and I was not aware. I'm not aware of the original document and what we're looking at here. So my suggestions were made in good faith. The second thing that is being asked is about number 4, which might be the same thing, that I'm making suggestions on things that are outside of what we're supposed to be looking at today. But it's that written or verbal quotes is the language used in number 4. And I'm just suggesting that if it's not onerous, that we always do written quotes. And I'm suggesting that because we have access to email, hopefully written quotes wouldn't be onerous. And further to that, saying in the moment, it's great for us to have the reason why, and it removes any conjecture around conflict of interest or lack of transparency if that one sentence, one paragraph is in there. If it's in writing, it's clearer. And also for the future potential audits, it's easier to go back on the piece that was already written in the moment. Is that helpful?
Great. Thank you. And again, I have absolutely no disagreement with your comments. I can say as a matter of practice, we have relied upon our purchasing person to periodically rely on getting phone quotes. Many times, some of these things they simply go, are you buying, yes or no? And we've said no, we've walked away. In some cases, we've gone to 2 or 3 different phone calls for 3 different for those phone quotes, and then made a decision on there. Now, they're fairly low in terms of total dollars. We very much prefer written evidence. So we are fairly well aligned, although we perhaps haven't had the full practice as you've just described for I'll say the lower amounts of dollars being spent. In any event, I completely agree with your thought process.
Okay, so do I have this correct? We're looking at this policy, we're revising it by doubling the numbers, only the numbers. We have a timeline set on it, and we're including the governance piece that either the chair or the executive would be aware of what's happening.
Madam Chair, if I may, of course, it's a board decision, and since I am the employee of the board and the one who's dealing with these things, if I can recommend to keep the policy the way it is with the numbers they are, plus adding the improvements that Helen Claire added. We have been operating, and it is my preference whether the words there was to consult with the chair and the executive committee or not. I have been operating based on that. As you know, I wasn't even aware that there is no oversight in the policy. And we're reviewing all our policies to start. Since I arrived here, there are 450, and our goal is to bring them to a meaningful number. That is a process that has not been completed, despite the fact that we've been working on it for a while. As you know, the pandemic really took a whole year out of that process. Nevertheless, going to that policy, we can specifically look at it, improve it, incorporate what Helen Claire mentioned. They're key. Nevertheless, I've been operating under the same recommendation, regardless of the policy. And if we can keep the numbers the way they are, that would be my preference. Having oversight is protection for all of us as employees, and it's better practice.
Okay, so we're going to leave the policy as it is. It's going to be taken back to staff, and they will review it, update it, and bring it back to the board.
Will be for some time.
Thank you. I would appreciate that.
Okay. And you're comfortable operating the way it is right now?
Correct.
Okay, so we can defer this item. I'm seeing nodding heads until it comes back. Okay, so we don't need.
Excuse me, I thought we were going to okay the numbers. Like when I read it, I thought we were just okaying the increases just when supplies are short, and then the policy we can revise, like the wording.
We were, except Dr. Era is saying he is comfortable with the policy the way it is right now.
With the existing numbers?
Yes.
Okay, sorry, I missed that.
Yes.
Okay.
Okay, so we'll wait for that to come back to the board eventually. So. All right, moving on. Next, is it, we're waiting to go in camera. We have an individual joining us. So is this the appropriate time? I guess it is.
Correct.
All right, so I need a motion to move in camera, and the reasons why: advice subject to solicitor-client privilege, 1 item; litigation or potential litigation, 1 item; personal matters about an identifiable individual, 1 item; labor relations or employee negotiations, and we have 3 items. So I need a mover and seconder. I have Al and Brian O'Leary. All in favor? That's carried. Thank you. So we will now move into in camera, and I will wait for the okay that the right people are in the meeting. We are in open session, and I will declare that we only discussed the items that were on the closed meeting agenda. From that meeting, we did have a motion to approve the January 22nd in-camera meeting minutes. We gave staff direction for 1 item. We received information for 4 items. And coming out of the in-camera meeting, I need a mover and seconder to approve paying Dr. Era the weekend work premium. So I have Brian O'Leary and Helen Claire to second. All in favor for that motion? That is carried. Thank you. So we have 1 further item on the open agenda, and this is the Association of Local Public Health Agencies, the annual general meeting and call for resolutions. So I can ask, is anyone, would anyone like to attend that, for one thing? And are there any resolutions that you think we could bring forward? Helen Claire.
I would definitely like to attend, and not sure if you want to hear this now, but with regard to the awards, the Alpha Awards.
Yes.
May I speak on that,
Please.
Madam Chair? Okay,
Yes.
I would like to suggest that we nominate Dr. Ara for the DSA for his outstanding management of COVID-19 in this community.
I was thinking the same thing, so. Any other, Anne?
I read somewhere, I thought, but maybe I have it wrong, is that different people have to be nominated by different, like, so if you're a doctor, you have to be nominated by one organization, et cetera, et cetera. So I totally support nominating Dr. Era, but I just wanted to be clear if we have to recommend him for a nomination with any other professional organization with this.
I can, it says who can nominate, and it says any member of Alpha, including Board of Health members, medical and associate medical officers of health, and affiliate representatives may nominate. So we should be able to nominate Dr. Era,
Okay, that's great.
I think.
I totally
Al?
support it.
Well, I was going to say, Madam Chair, I think from the discussion we had earlier of all the good points that have been brought forward, as you know, that's just a prelude to put on that form, as well as you know, the article that's being proposed. I think those are two things that can run simultaneously, just to nominate them for that award with that. So I certainly would support that. And second of all, I would like to participate in that one-day virtual conference, and on, I think it's June 8th, if I'm not mistaken.
You're correct. Yes.
Participate in that as well.
Would anyone else like to participate in that, the AGM?
I would, if, are you participating, Sue? I'm assuming you are.
Yes.
Madam Chair?
Yes.
Thank you all for your remarks, and I'm honored. Thank you. I wonder, in terms of resolution, if you, as a board, are willing to direct us as staff to put forward the resolution to utilize the efforts of public health after the pandemic is over to address the opioid emergency, and we can highlight in such resolution that whereas a clause that the health units did amazing job in managing the pandemic in different areas in the province, and we have the resources and the expertise to mobilize the partners to address emergencies, and the next emergency to be addressed would be the opioid emergency, and we can deliver as health units similar to what we delivered in the pandemic.
Thank you for that. I think Brian O'Leary is going to move that. Brian?
So moved.
There you go. Seconder? Al Barfoot. All in favor? That's carried. Thank you. So I have 4 people, Ann Edie, Helen Claire, Al Barfoot, and myself attending the AGM. If anyone else would like to attend, the deadline is April 23rd. So please let Sue or Aaron or Dr. Aaron know, whoever. So you have a bit of time to think about that. So anything else with Alpha, or do you think we have that covered? That's some good information. Okay, that's the last item on the agenda. We need a mover and seconder to adjourn at 1:20. So I have Selwyn and I have Brian Millen. All in favor? Thank you very much. A long meeting, but a good one. Lots of good information shared, and appreciate it. I hope you enjoy your weekend.
Hey,
Done, Madam Chair.
everyone.
Thank
Take
you.
care.
Bye-bye.
Bye now.
Maple Leaf.
Yeah!